Hello everybody, it's Dr. Garrett Wegerif here at Pure Plastic Surgery. This week we're discussing patient safety. It is Patient Safety Awareness Week, and so we're going to be going over some of the things that you should be looking at when choosing a practice and some of the things that sets Pure Plastic Surgery apart and why you may want to consider getting surgery with us. So to start with patient safety, it's a very broad topic and encompasses many different things. So where do you really start with this and what should you be aware of? I think the most important thing that you should be thinking about when choosing your surgeon is looking at his qualifications. Make sure he went to an accredited training program and actually did his training, that he has no hits on his medical license, and that they don't have any, concerning findings on a brief audit online of this surgeon. So number one is qualifications. The second thing you should really be looking at is the facility where you're going to be getting the surgery done. So different plastic surgeons have different options when it comes to surgery. Some surgeons operate out of a hospital, some out of a surgery center, and then some have office-based surgery centers, which a lot of the plastic surgeons here in South Florida have office-based surgery centers, as do we here at Pure Plastic Surgery, where we do all of our cases out of. The things you need to think about with that is these office-based surgery centers have different qualifications and certifications, and those make a difference when it comes to patient safety, because it looks at all the things with our record keeping, with our backup equipment, with our arrangements we have with hospitals if there is ever an emergency and we need to transfer a patient. So we're certified by the Joint Commission, which is a very high level certification. We are JACO certified, and it's a very high level certification to obtain, and we do a lot of work and we're proud of that certification, and that's one of the things that sets us apart down here. The other thing you want to think about when choosing your surgeon is how you are getting cleared for surgery. And some patients find this process a little frustrating at times, but we here at Pure Plastic Surgery take a lot of time to make sure you get clearances by your primary care doctor. You get all necessary imaging. If you're getting breast surgery, we make sure you get a mammogram if you're at the age where you should be getting mammograms, to make sure there's no concerning findings on that. You get all your lab work done, an EKG done, and a chest x-ray. We really want to make sure that you are fully optimized going into surgery so there's no unexpected problems leading up to that. And we'll unfortunately sometimes turn patients away if they don't have their clearances beforehand and they're not completely optimized, because safety really is our number one concern. The other thing you want to think about, depending on the actual type of procedure you're going to be getting, what kind of safety measures go into optimizing those procedures to make sure they're as safe as possible, particularly with BBLs or fat grafting to the butt. It's always, a point that's talked about here in South Florida, that it's potentially a dangerous procedure. And then even though the state of Florida has recently made a change where everybody is supposed to be doing image-guided fat grafting using an ultrasound to make sure you're in the right plane above the muscle. Not everybody's been doing that for a long time, and at Pure Plastic Surgery, that was adopted very early on, and all the surgeons here, we've been doing all of our BBLs with ultrasound guidance for, I've been doing it since I came out of training, and that's the only way I've been doing it. So, we're well versed in those technologies and doing that as safely as possible. So I'm going to open it up to you guys. Or I guess one more thing I should say, when looking at the facility or the surgeons, you have to look at, what hospitals they have arrangements with, what hospitals do they have privileges at. If you were to ever have a problem where you can go in and see your surgeon at the hospital if you ever needed to. And then also we have, transfer arrangements. If there was ever an issue in the operating room where you need to be transferred, you could quickly get you to the hospital that we have a transfer arrangement with. So, any questions from our audience about patient safety?
Yes, there's one question about patient safety, and there's also a comment where there's different products that help patients during surgery. There's I believe a few of them for medicine, or no?
Well, yeah, I mean, there's a million different medications and things that we use during surgery to, make sure optimize everybody gets preoperative antibiotics and that kind of stuff to decrease the risk of infection. If you required it, if you were at risk for it, we could give preoperative blood thinners or postoperative blood thinners to help decrease the risk of blood clots. We always send our patients home with patients that are at least getting an abdominoplasty with the device for your legs that helps squeeze your legs to decrease the risk of having DVTs or blood clots.
Okay.
Okay. All right, everybody, please shoot me a message if you have any further questions, or if you're interested in a consultation. You can find me at pureplasticsurgery.com, and a little window pops up to start the consultation process. I hope everybody has a great day, and I'll see you next week.
All right, thank you so much. Give us a bye, and then we end it.